Hello, this is Shawn Hamilton, Clinical Product Manager here at Axxess. And on this on-demand video, what I would like to do is to first go over the plan of care in Agency Core. So there's been a lot of confusion regarding the process of the evolving plan of care. And what I would like to do is to demonstrate for you from QA how you update the plan of care. So the clinician in the home, according to the Medicare Conditions of Participation, is responsible for the individualized plan of care, which means that the clinician is to complete the individualized plan of care with the patient, and they are to discuss the plan of care with the patient as well as the patient representative if one is involved in the case. And there's documentation on the summary of care for them to indicate that this was done according to the patient rights. So in this scenario, the clinician has already completed the plan of care in the OASIS, and whenever the clinician signs their OASIS assessment, the plan of care is automatically signed by the physician, and it goes to the chart in green because the clinician, in essence, has completed the plan of care. So for today, what I will do is we're going to look at a PT OASIS start of care. And so the first thing I will do is go to the plan of care. This plan of care is within the 5-day window. On part 2, I will discuss the process for plans of care that are completed outside of the 5-day window. Okay, so with this plan of care, I want to edit the plan of care because I don't like the way that it's looking. The QA is allowed to change the primary care physician. If you would like to add or edit the medication, you're able to do that as well. For the diagnoses, especially if it's going to coding, diagnoses are basically the green sections on the OASIS. And then the locators here for prognoses and mental status, these items are the gray sections within the comprehensive OASIS assessment. And I will show you how to update that in just a minute. Now, the caregiver status is also something that Medicare is interested in knowing about. And so we give you the ability to actually document that in the summary of care. That is for the clinician to document. And if you don't want it to print on the plan of care, you can easily check that box. And then the psychosocial status is also a new indicator on the OASIS plan of care. And if the clinician documented no problems identified, you would see that there. However, if the patient did have psychosocial issues, you would see those register in that box. I will come back to the plan of care orders. The goals are here. The rehab potential is there as well. The homebound narrative, the medical necessity, and the face-to-face addendum. So one of the things that you will notice immediately is that if your clinicians are in the habit of not completing their plans of care and developing especially that medical necessity, this is going to be a process change. And, you know, of course, this is related to the conditions of participation. So Axxess, we are not, trying to make things difficult. We're just simply trying to help you to be compliant and also to survive the wave of probe and educate that is getting started. So some of you already may have been involved where you have had 20 to 40 records being pulled at one time. They're just getting started, so some of you may have not experienced that yet. But this plan of care is going to help you to be successful. Okay, so if I want to, as the QA, audit and add the plan of care orders, I'm able to do that from this section. Now, because I am QA, I will be able to see all disciplines. And this is a PT oasis. So when I look at the PT oasis, I can immediately see the problem statements that the PT identified for the patient. There's a high potential for hospitalization, a need for advanced care planning, alteration in home environment, and high risk for falls. And so immediately, if I was looking at this plan of care, this is not the information you would want to see coming from your therapist. You want to know, what are you doing for therapy? And so let's say if you did want to simply edit something, you would be able to do that. So what you could do, let's see, this first one is high risk for hospitalization. If you wanted to edit that, you would be able to edit or Q transfer due to recent hospitalization and history of ER visits. And then you may want to put the number 3 within the last month. This is how in-depth your clinicians will need to get with these plans of care as they seek to individualize things for Medicare. Okay, and then when I go to, if I want to add, maybe the therapist, I ask the therapist, you forgot to add some things, and they forgot to add, let's say, they want to do exercise, home exercise training. So you talk to the therapist because the therapist needed to discuss this with the patient and to document it. But they told you, yes, I just forgot to document that. So you can see here, you can add that information, and then you can also add a goal. Now, when you add the goal, anything that you see inside of the asterisk, that is supposed to be replaced with information. So this says patient will demonstrate compliance with home exercise program and improvement to. So they need to enter a functional description and objective data for measurements. That's going to be very important. And so you're able to edit as much as you need to. And then the term, they must select long-term or short-term as the goal. So you're able to select that there. The homebound status as well as the medical necessity is being added to all of the problem statements for therapy. So that is not here right now, but you will see that within the next day or two. So I'm going to save and exit. And now impaired functional strength becomes a part of my plan of care. So let's say that the therapist calls and says, the daughter called and actually gave me the advanced plan of care. You can just simply say that order was added in error. Okay, so I'm going to save and exit. And let's look at some of the things I added. So you can see here I added physical therapy to perform therapeutic exercise. So those orders are there. Okay, so now you notice that I changed the risk for hospitalization, but it didn't come across. I did that on purpose because I added some special characters in there, and you can't do that. So when I went to physical therapy, and I got 2 additional risk factors, and I edit it. I had a 3, and we are not able to add parentheses in here. So again, I'm going to change this documentation, and let's see, due to 3 ER visits this month, just as an example. Of course, you want to augment this data much better than that, but here we go. I'm going to hit save and exit. And when I come back, now you're able to see my due to 3 ER visits this month. That information will flow there. Okay, now again, I'm QA, so I need to get this care plan situated because it doesn't look so good. Also, I want to bring to your attention that you can hit the refresh button if things don't automatically refresh for you. You are able to click that button. So what I'm going to do is I'm going to go into the plan of care. And again, I'm QA. So as QA, I'm going to hit edit. Now, as the QA person, what I'm able to do is I can change green sections and I can change gray sections. From this view, I cannot change the clinician's information. I mean, I can type things here, but it won't record. So what I am able to change is anything green. Medicare does say that the agency is responsible for the OASIS, and the QA is able to change the green sections, but you must coordinate with the clinician. So if I go to patient diagnoses and I come here, and I don't want muscle weakness as my diagnosis. I'm gonna take that away from there. I want to have, let's say, heart failure. Let's say hypertensive heart failure and kidney disease. And I want that to be the primary. And you can add as many diagnoses as you want. I guess we'll just go ahead and add another one. Okay, and then you want to be sure to put in your severity codes. Again, the clinician, this is also in the ICD-10 guidance, the clinician is supposed to determine the severity, and the clinician is also supposed to determine what the primary reason is for the skilled care that is being provided to the patient. Okay, then we have the gray sections. So I'm not going to update all of them, but there were several on this plan of care that was not updated. So let's just update a couple. So when I go to the functional section, I'm able to update that, as you can see. And then I will go to the neuro section because I don't think that one was updated at all. And we're going to say oriented, forgetful. All right, so then you would check for errors. And when it's done checking for errors, it tells you here to just, hit exit and then hit save and exit to return to the QA center. So that's what we will do. So when you come to the plan of care, I'm going to hit edit. The first thing you will notice is that it doesn't appear that anything was updated. So you have to refresh. And when you click on refresh, now you can see all of the items that were added. The mental status, functional limitations, and you can do that for every single locator that is here. So the idea is that the clinician should complete the plan of care in the home, and when this information comes forward to QA, it should basically be filled out and completed. But this is just an update just to show you how to do this. Now, what I will show you next is after you have completed the plan of care and it's been QA'd and coded, I'm just going to complete this plan of care on this patient, Mr. Harrison. So now I'm going to approve it. Now, the plan of care summary is not created until the plan of care is approved out of QA. So what is the purpose of that? Well, if orders are being written in QA and added, and I am the clinician that is following, I really don't know what the final orders are. Or if things are added, after the fact, then it could look like I did not have the correct orders on the proper date. So it's going to be important to really get those plans of care completed within 5 days. So what is the purpose of that? Medicare talks about timely initiation of care. And they believe that that is directly related to the high hospitalization and readmission rates, and that they are so adamant about this timely initiation of care that it is a part of the star rating system. And so we want to ensure that the clinician in the field is doing the proper work in order to speed documentation along quicker so that the patient can get orders quicker. And if you think about it, the premise that they have, and I don't know if you are aware, but when they were first looking at this evolving plan of care, what they were thinking about doing was having the, one plan of care for the patient. They still are thinking about doing this. One plan of care for the patient that originates in the hospital. And then the patient actually leaves the hospital with that plan of care, and the physician updates the plan of care. Now, why are they doing this? They know in home health care that we have a bad habit of not having timely orders. That is why in the conditions of participation, everything must be date timed and stamped because of that habit. And what happens for whatever reason is that we don't think about that when you are a patient in the hospital and orders are written, they are written and carried out almost in real time. And in home health care, for whatever reason, sometimes, we wait several days to input orders. And so we don't want to do that. So if you complete the plan of care in a timely manner, I'm going to go to the patient chart. So if I go into the patient chart, and I'm going to go to this patient Harrison. So when I go to Harrison and I look at the plan of care summary, there it is. So if I'm the PT, I'm able to, the PTA that's following, I'm able to see all of the orders that I will need to treat the patient. Now, if you notice here, this says skilled nurse. So there are some interventions that are on the tabs, and in there it says skilled nurse. So the therapist will definitely need to edit that out and put physical therapy. I didn't go through the process of just totally editing this plan of care because I'm trying to hurry up and show you the functionality. But let's say, and for right now, I'm just going to show you how to, what it looks like for the clinician, because sometimes when you work in the office, you're not aware of what clinicians see in the field, and sometimes when you are working in the field, you definitely are not aware of what is going on in the office. So I just want to show this an example. We're updating all of our notes, but this will be basically the view that clinicians will see. Okay. I'm going to say, I just want to show you that with your clinicians, whenever they open up their notes, and right now this is the skilled nursing note. They have this view plan of care summary button, and so with this button they are able to see all of their interventions. And also what I didn't show you is that it's printable for the patient. So as you can see, we're able to have this ability for you to print this for the patient so that they can have a running log of what's going on. Because, you know, anytime that you change a medication or you add an intervention, you're going to have to send a copy of that updated plan of care to the patient. Okay, I hope that was helpful. On part 2, I will walk you through the process of when you are getting that 5-day warning. Okay, thank you.